Hello friends, welcome to our channel Dr. Scott. Today's our topic is on head and neck part 3. So in this video we will learn about topography of lateral region of the face. So here I already written. So lateral region of the face divides into two parts. Superficial and second is deep. Superficial lateral region and deep facial region. Okay, now superficial it's also divided into two parts, cheek or you can say buccalis, cheek region, and second is parotid mesenteric region. Parotid mesenteric region. Okay, so now we will see the topography of superficial lateral region of the face. Okay, so superficial lateral region of face. So we will see the landmarks divides into two parts. The landmarks are possible: zygomatic bone, or you can say by zygomatic arch, and the lateral margin of eye socket. Now borders. So here I draw a box. Right, this one will be superior, this one will be inferior, this side will be anterior, this side, right? So here I anterior and this side will be posterior. So superiorly we have zygomatic arch or zygomatic bone and the inferior margin of eye socket, like this, from here till here. Understand, this is zygomatic bone till here, and from here there will be this eye socket, this whole thing, right? Inferiorly we have mandible, right? Inferior margin of mandible, like this. Okay, now anteriorly we have the nasolabial folds and nasobuccalis folds. Here I just write the nasolabial folds, nasobuccal folds, and commissure of lips. Now posteriorly we have mastoid process. Yes, we have mastoid process because we have here like occipital bone, and we will have mastoid process. From here we will have occipital bone, and here we will have temporal bone. So zygomatic process, zygomatic foramen, and styloid process, like this. So posteriorly we have mastoid process. So here we have landmarks. Superiorly we have zygomatic bone and eye socket. Here I will write zygomatic arc, right? Anteriorly we have nasolabial folds, nasobuccalis folds, and commissure of lips. Now inferiorly we have inferior margin of mandible, and posterior side we have mastoid process, right? Now we will see the topography of buccalis. Topography of regio buccalis or buccal region, right? So first we will see the borders, same like that. Here we have something different, like this is superior, as usual this is inferior, but it have medial, and that side we will do lateral. On back side we will have lateral, on this side we will do a medial, so medial here and lateral here. Okay, do you understand that? Now superiorly we have inferior infraorbital margin. Here we will have like via eyes. Here will we have infraorbital margin. Okay, infraorbital margin. Inferiorly we have the same inferior margin of mandible, like from here we will have like this. So inferior margin of mandible, inferior margin of mandible. Okay, now medially we have the same nasobuccalis and nasolabial fold, nasobuccalis and nasolabial folds, right? And the laterally we will have anterior margin of mesenteric muscle. Mesenteric muscle. Mesenteric muscle is the muscle of the face which help in the chewing, right? Now we will see the layers of the buccal region. So layers, first skin, then we will have subcutaneous tissue, then we will have superficial fascia, then we have deep fascia, and then we have muscles, right? Now the most important thing we will see here is the Bichat's body, which is found in the superficial fascia. We have body, and it is like a adipose tissue which is lies between buccinator and masseter muscles, and in child and in adult, the child have more amount of buccinator body than adult. That's why they are chubby cheeks. They have chubby cheeks. This is the reason why they have chubby cheeks, is the Bichat's body. It is more in child and less in adult, and it is found in buccinator and mesenteric muscles. Okay, now we will see neurovascular bundles of the cheeks, right? So which artery, vein and are inverted in the buccal region. Okay, so neurovascular bundle, right? So the first artery is facial artery. So if there is a facial artery, then there must be a facial vein by the same name. And from the cranial nerves we know that facial nerve is inverted in the face, right? Now the two more neurovascular bundle are also innervate here. Second is infraorbital neurovascular bundle, right? And the third is meatal neurovascular bundle. How we will remember this three bundles in the cheeks? There is a easy way to remember. These three you can remember that it's a part of face. So there must be a face vein, artery and nerve. Now if you see here in the topography, the superior border have infraorbital margin. So there must be something neurovascular bundle related to the infraorbital margin. So the second one, infraorbital neurovascular bundle, is made for infraorbital margin. The third and last, here you can see inferior margin of mandible, right? So in mandible we have meatal like here, right? So meatal neurovascular bundle is made to inverted here, so you can remember by this. So which three neurovascular bundles are here? First, it's a face, so facial artery, veins and nerve. Related to superior margin, infraorbital neurovascular bundle, and the third is mandible. So we can say meatal neurovascular bundle, right? Now we will see the topography of parotid mesenteric region. So topography of parotid mesenteric region. By the name you can think it is related to parotid gland and mesenteric muscles, right? So here I have a diagram on parotid mesenteric region. So here we have a diagram, right? So first we will talk about the layers. Layers, it consists of skin, subcutaneous tissue, or you can say subcutaneous fat, superficial fascia, right, this blue color, and the deep fascia, right, which is known as fascia parotid mesenteric fascia. So this fascia is also called deep fascia. And the muscles are like mesenteric, temporal. Okay, so there are 5 layers: skin, superficial temporal or superficial fascia, parotid mesenteric fascia or deep fascia, and the muscles, right? So now we will see the borders. Here on anterior side you can see this part is anterior. You can see a mesenteric muscle. Inferiorly we have mandible, like let me draw a diagram here. Here we have square, right? Anterior, inferior, superior and posterior, right? So these are 4 borders we will see. So on anterior side you can see the anterior margin of mesenteric muscle. So here we will draw the mesenteric muscle, right? Now on inferior side you can see the base of the mandible like this. So from here it will start and like this we will have so this is the base of the mandible. So on inferior side we have the base of the mandible. Now on superior side, here we will like this on that side, right? From posteriorly to anterior we will have zygomatic bone. here you can see the part of the zygomatic arc, but it's from posterior to anterior, and we cut this part from anterior side, so you cannot see the posterior part of the zygomatic bone. But I will draw like this, right? Here we will have zygomatic arc. Now on posterior side we will have mastoid process, the apex of mastoid process, and the, wait a minute, we will have mastoid process like this, right? So we have something imaginary line here from the angle of mandible to the apex of mastoid, like this. We will have imaginary line like this. So this is the part of the posterior border. Now we will see the neurovascular bundles of the parotid mastoid region. The first is facial nerve. You can see here the glitterate color, facial, this is the facial nerve, this pink color, right? Wait a minute. Yes, this orange color is the facial nerve, right? Now we will have auriculotemporalis nerve. Here I didn't draw. And the third is external jugular vein. So wait a minute, like I'll draw. Don't confuse with the blue color with, let me take another color, light green. So here we will have facial nerve will emerge from the posteriorly to here, facial nerve. Right? Now we will have auriculotemporalis nerve. If you think that here we will have a zygomatic bone, so on this side we will have auriculotemporalis nerve and the external jugular vein. So from the neck we will have a internal jugular vein and external jugular vein. So it will emerge like this, like this. So which are these nerve and veins? So this is facial nerve, this one will be auriculotemporalis nerve, and here will be external jugular vein. External jugular vein. This is how it innervates here. This is the part of the superficial lateral region. Now we will see the deep facial region. So topography of deep facial region. So here we will draw a box. Right, this part is superior, this part will be inferior, anterior, posterior, that part is lateral. Here that backside part is lateral, and this one part will be medial, this whole part will be medial. So on superior side we have greater wing of sphenoid bone, greater wing of sphenoid bone. On medially we have medial pterygoid muscle, medial pterygoid muscle. On anteriorly we have maxillae, tuber maxillae. On lateral side we will have ramus of mandible, and on posterior side we will have condylar process. Okay, inferiorly there is nothing, right? It's free. So here okay, with brown. Here if you think like that, here will the mandible, okay, here somewhere will be the maxilla, okay, on the medial side. But wait a minute, here we will have sphenoid bone. It's on the back side, right? Because it's a deep facial region. And this is ramus of mandible, okay, and on the back side we will have medial pterygoid muscle. Okay, so this is how it looks like. It's difficult to understand, but you have to just assume that here will be the maxilla, here will the mandible. On the posterior side we will have the sphenoid bone. On the downstairs to sphenoid bone, what we will have, the pterygoid process, and which connects with the pterygoid muscles, and the ramus, which is the part of the mandible. That's it. Now we will see the topography of parotid gland. Okay, so here in this diagram you can see the topography of the parotid gland on the behalf of the skull, and this is on the behalf of the muscles. Okay, so first we will see about the skull. Okay, you can see it has superior, inferior, lateral and medial, right? So here on anterior side it have anterior also. So on anterior side, wait a minute, on anterior side we have the muscles, on posterior sides we also have the muscles, on the inferior side we also have the muscles, and lateral sides we have the muscles. So the left things are superiorly and medially. Superiorly, if you can see, then this is the external acousticus meatus, and this is a temporal mandibular joint. Here we have the mandibular, you can see here, and this is temporal bone. So we have the external acousticus meatus and temporal mandibular joint. On medially we have styloid process. That's it in the topography of the parotid gland on skull. And one more thing is left, the scalotopy. The parotid gland is located on the second cervical vertebra. Okay, now we will see on the behalf of the muscles. So on anteriorly you can see the mesenteric muscle and internal pterygoid muscle, mesenteric muscle and internal pterygoid muscle. Posteriorly we have the sternocleidomastoid muscles, right, which is the part of the mastoid process. Here you can see the mastoid process. And inferiorly we have the posterior belly of the digastric. We don't have the anterior belly of the digastric because it goes on the front side, so it's a posterior belly of the digastric. So on the let's put here the all the things. So what we have anteriorly, mesenteric muscle. On the mesenteric muscle we will found on the ramus of the mandible and internal pterygoid muscle. Okay, now posteriorly we have sternocleidomastoid muscle and the mastoid process. Superiorly we have external acousticus meatus and temporal mandible joint, no muscle. Okay, on inferiorly we can see the posterior digastric muscle, okay, and a small part of sternocleidomastoid mastoid muscle, as you can see here. Okay, on laterally we can see the deep cervical fascia and platysmic muscle. Okay, and medially we have the styloid process and pharyngeal wall, because pharynx will be here. So thank you for the watching. If you like this video, then hit the like button and subscribe our channel Dr. Scott, and please comment in our comment section which topic you want next, or I continue the clinical anat. So I'm waiting for your comments, so please comment and share the video as much as you can. So thank you very much.